Good morning, Miss.
Hello.
Hello, Miss. Why are you here?
Yeah.
Looking for any testing?
Yes. I have to do OGTT test. Doctor said I have to do it, but I'm 12 weeks.
So you are then 12 weeks. So you have to wait until 28 weeks. After that, you can do that.
Why am I wait to 28 weeks?
I think that doctors believe that your baby fully grows in 28 weeks. After that, we do the test, and for the test you have to we take 3 blood samples.
Why we do this test?
This test for the your that when if you don't have a diabetic, so in diabetic history, but some patients have diabetic on the pregnancy time. It's called in a medical term gestational diabetes. Yeah, gestational diabetes, and at that time we have to monitor and we have to do that other procedure. If your sugar level is continuously high, the baby will get more energy and they can grow very large baby.
Why can't we assist from the fasting blood sugar?
That one single test you can't unless you can't we can't take the idea about that your fasting your metabolic level and your insulin level. If you check the fasting blood sugar, you already control your foods and your activities, and you when we check the fasting blood sugar, it will be normal. But after that, you take the foods and something, your insulin level will depend on the insulin level. The blood sugar level vary in the body. So that's why we give the glucose solution. After that, we take the blood sample, 2 blood sample from you drinking first hour and second hour. So that if your insulin level is okay, that insulin will actively work and they can reduce your blood sugar level.
Okay, I can understand now. Then when we start before I this start this test, I have to take glucose packets.
No, then if you came that this private hospital, we give all the materials and sugar and disposable cups, and the sugar cup, glucose pack is given with that disposable cup. Just we use the water and mix it and give. If you went to the government sector, you have to bring the glucose pack, and they will prepare and they will give to the you. Before you drink the glucose, before take the glucose, you must give the first sample of fasting blood sugar. After that, you can drink the glucose. Then you give the first hour blood sugar. After that, wait for 1 hour, and after give your second hour blood sugar.
Totally 3 samples.
3 samples within 1 hour period.
Okay. Some people, some patients believe that private sector reports have accurate, more accurate level. What is the difference of these private sector or government sector?
If we take the government sector, we can get more samples. So with the volume of the sample, that number of the sample, that error rate will be different. If you think that if we get 1,000 samples, there is a 2% error rate. There is 20 errors. If the private sector, we get only near the 50 samples. So if you take the 2% error, there is only 1 error. So that's why that error number of errors are changed with the private and government sector. And if you take the private sector, we process the sample with the barcode system. So there is no errors in the barcode system. Only we get the sample and get the barcode. If you take the government sector, they all are right with the handwriting. They see that. Sometimes that 0 look like 6 or 9. So we can run the sample with barcodes. Then VHC numbers, it can lead to change or misleading to the
Yeah,
uh,
I
sample.
can understand.
That if you modify with that, if we go with the technology, we can reduce the error rate.
Error rates. Now these days, government sector also have some these kind of.
Yeah, then we have to move with the technology. So that's why that most of the hospital go for the barcode system and the barcode
Now
sampling.
it is
Yeah, barcode
changing.
sampling. Yeah, when it's completely implemented, you can't came to collect the report. Your report will came to your telephone number or WhatsApp. You can download from your home. After that, if you work in the ward, if you admit to the ward, when we collect the sample, just send the sample. After that, the report will be it directly go to the wards. There is no any person to go to the collect the report, and their manpower wastage are very reduced.
Okay, I can understand. Thank you for your details.
Okay.
Well done. Very good.